a.m. Let me see. Would you mind leading us in the pledge this morning? Member Costa, I'm sorry.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, it looks like we have a fairly short day today. So let's have a roll call, please.
Mitchell, Butler,
Butler,
Costa, Dean Schlattman, Williams, Freeman.
here.
We have a quorum.
Can I get approval of the minutes from July 9th, 2024?
So moved, Mitchell.
Can I get a roll call, please?
Mitchell,
Yes.
Butler, Costa, Williams,
Yes.
Freeman.
Yes.
Motion carries.
We do not have any old business. New business, we finally have a presentation. I've been working on getting this presentation here for a while. There's been delays and whatnots, and it's finally going to happen. From the Spanish Community Center with Sylvia Chavez. Would you like to come up, please? If you don't mind just introducing yourself again, and oh, I have to hit the button. Thank you, Kim.
Hey, good morning, everyone. My name is Sylvia Costa Chavez, and I'm the Executive Director at Spanish Community Center.
And she has a slideshow. for
Okay,
us.
perfect. I know I've had the opportunity to meet some of you already, and we actually met at the Spanish Community Center, so some of you might already be familiar with our programs and services. But I did want to present, and I appreciate the opportunity just to speak a little bit more about what we offer across all of Will County. I do want to start off by sharing a little bit about the history. The Spanish Community Center was established in 1969, and it was established in a time period that was very similar to what we're experiencing now in terms of recent arrivals, in terms of immigrants arriving, particularly in the Joliet area. And it was a group of people that wanted to provide services that were multicultural, bilingual, to be able to enhance the needs of the people that were joining our community. And since then, we've grown, we've introduced programs, and we've been able to now serve communities across all backgrounds. The main group of people that seek our services tend to be Spanish speakers, tend to be immigrants. However, we don't discriminate. Our doors are open to everyone. So don't be fooled by the name. I know a lot of people think that it's only specific for a group of people, but that's not the case. Next slide. Thank you. So we do have, next slide. So we do offer, next slide. Thank you. We do offer services across 4 main areas. The first one being early childhood education, then social services, adult education, and immigration. And we offer we have 3 locations, one of them in Kankakee County, 2 in Joliet, again, serving all of Will County. And then we are doing some work in Cook County with recent arrivals. We started in 2022, first at the hotels and the police stations, and now we're at the shelters. Next slide. And this is more or less, this is updated data. This is more or less what we've been able to provide just in FY24. So these are all of our programs, and underneath each one, you'll see the number of families or individuals that we were able to serve. We have some that, for example, like the food pantry, were in the thousands, and that's just counting individuals. If we were to count the number of the number of household members that indirectly benefit from the services, it would be closer to 15,000. And the same applies to all of our other areas. We did a lot of work with over the COVID time period with community health navigators. We had a program specific to that. We had other programs that were more or less temporary, such as the R3 program, which was Will County served as a fiscal agent for, but all of our other programs are pretty consistent. And in fact, we've been able to expand them in the last few years. All in all, in FY '24, we served over 13,000 individuals, which is about 2,000 more than we did the previous year. I know that there has been some questions about whether or not we're seeing an increase in recent arrivals, and we have. Because of the services that we provide, many people are coming to us as a first choice. They reach out for anything between basic needs such as housing to, of course, immigration services. So we've been able to document all of that, and all of our programs, especially Food Pantry, has been the first choice for many people. So we have seen that many more people are coming our way. The first program that I want to talk a little bit about is the early care and education. So again, all of our services are bilingual. This one focuses on children ages 2 to 5. And recently, just a few months ago, we did partner with Catholic Charities. So we became a Head Start provider. And what that will allow us to do is obviously focus a little bit more on enhancing the curriculum, the experience for the children, their own development, and then obviously supporting the staff and personnel to be able to improve the needs of the children as they start their academic career. Next slide, please. We do also have a welcoming center, which is one of the programs that we were able to reintroduce just last year. This is a program that we had and unfortunately lost a few years ago, and it serves as the first point of contact for many families. They come in, we do a holistic intake to try to identify if there's more needs in what they're sharing or disclosing to us. And then from there, we connect them to some of our other internal programs or even some of the community partners that we have. And there's a case management piece to it that allows us to follow up just to make sure that all of their needs are actually addressed. Food Pantry. We are in the process of transitioning to a client choice model. So throughout the pandemic, we had to do drive-through. So every client would be coming through and would receive a pre-made bag. And now we want to be able to give them the option to determine and select what they need for themselves and for their families. So in the next couple of months, we'll officially be making that introduction. And we've had the opportunity to partner not only with the food bank, but some of the local retailers. We are seeing about 150, 160 families per week. And what the inventory that we've been receiving from the food bank, it's just not enough. So we had to seek these additional partners to be able to meet the demand. Next slide. The Immigrant Family Resource Program. Again, don't be fooled by the immigrant word. This is a program that was originally started by the Illinois Department of Human Services to focus on the access or lack of that immigrant communities had to public benefits. So we focus on helping people apply for SNAP, for WIC, Medicaid, Medicare, and we walk them through all of that, from submitting the application to doing the follow-ups with the IDHS office. And then even after they've secured the benefit, we do what are called redeterminations to make sure that they don't lose their benefits when they have to update any information. Next slide. Southern Border Arrivals. This is a program that is not offered here in Will or Kankakee counties through our main service areas, but we are doing the work in Cook County, and we've been out there for the last couple of years. So we've had case managers help in the 3 different locations that the state has been able to organize. And we've been helping families really through the entire process of enrolling children in the local schools, walking them through the immigration services that they might be eligible for, such as temporary protective status, asylum, and then making sure that they get the help that they need to become fully independent and eventually transition from wherever they are, whether it be the hotels or the shelters. Next slide. Family Advocacy Center. This program works very closely with the Department of Children and Family Services. So we do receive referrals from DCFS for families that are investigated or that have an open case for abuse or neglect. And we support primarily the parents. We don't work directly with the children, but we do work with the parents to complete some of the services that the caseworker or the judge has required of them to be able to either reunite the family or prevent the children from being placed in foster or relative care. The other side of this is that we work with a lot of families that are not involved with DCFS whatsoever, but that just need more one-on-one support. And through this program, we're able to provide furniture vouchers. So we get them through different partnerships, the items that they might need. There's cash assistance to cover some of the needs that might not otherwise be available through some of our community partners. And then we also focus on like the family engagement piece. So we've recently introduced opportunities for families to come together and to learn a little bit more about just how to have healthier relationships with their children within households, and to provide a safe space for them to be able to do that. Next slide. This is one of the new programs that we've introduced in FY25, and it goes hand in hand with the previous one, Family Advocacy Center, but this focuses more on fathers and male caregivers. We've seen that there hasn't been a lot of engagement from those groups, and we recognize that everybody in the household needs to be involved, especially to benefit the children, and particularly with Black and brown men, they have certain challenges that prevent them from actually being active and present in their children's lives. So this is a two-tier program. First, there's the parenting classes that focus more on the DCFS side of it, which is like preventing abuse and neglect and how to do proper discipline, how to be more involved with the children. And then the other side would be the support groups, which is more about interacting with one another, learning about each other's challenges, and then together determining what needs are available. And then it's a 12-week program. Again, this is fairly new, but then the objective is to make sure that they're connected and that they develop better relationships to be able to co-parent better and then overcome some of the challenges that they've experienced throughout the way. So there might be a need for expungements or other services to get them employed or to get them more stabilized, again, for the purpose of better being there for their families. This is another program that we were fortunate enough to receive from DCFS, and it's the extended family support, and it's kind of the replacement of grandparents raising grandchildren. So this is for families that are not involved formally with DCFS, but that are caring for children and their families. And the point is to help them obtain guardianship and secure some of the basic goods to be able to better support the children. So this goes hand in hand with the other program, the Family Resource. If they need to apply for SNAP or for health insurance for the children to stay long-term with them and be in a better situation than they perhaps were with their parents or guardians. Housing advocacy, we did receive a grant and we've been able to continue this program for violence prevention. So this also works with DCFS. This is a little bit different than the Family Advocacy Center because the focus is not so much on abuse or neglect, but rather families that have gone through the system because of inadequate housing. So if there are 6 people living in a one-room apartment, or there are cockroaches or things like that, the families are referred to us, and then our case managers work with landlords and accompany them to open houses, work on building the credit, educating them about budgeting, so then they're able to meet those month-to-month expenses and obviously ensure affordable and long-term housing. The other piece of that is for just walk-ins, again, families that are not involved with DCFS, but that are also facing some of the similar challenges. And there is a financial assistance piece to this, but because it is a grant through DCFS, we can only use that to support households that are being referred by them. Our immigration program, there are only 2 people in the country that can really help with immigration matters. That is obviously a licensed attorney and somebody that is either partially or fully accredited by the Department of Justice. So we do have somebody that is accredited and that is able to submit applications on clients' behalf and represent them in immigration matters. And we're working on a succession plan to make sure that we expand that because there is a large need for that. And unfortunately, in Will County, there are not enough immigration attorneys. There are very, very few. And those that do practice immigration law are just not bilingual, not to mention that many of the families are not able to actually pay the thousands of dollars that process would require, especially if it's a process that takes years to complete. If they're applying for like a U visa, if they've been a victim of a crime or torture or human trafficking, or if it's like a family petition where they're trying to seek immigration relief for family members. And we are working with some partners that we have in Chicago to do some workshops and to basically replicate what they're doing out there with TPS on asylum cases, but more at a smaller local scale to be able to support people in the pro se process. And last but not least, our adult education. All of the programs that I mentioned have an education piece to it. So for example, immigration, we offer citizenship and ESL classes. And we do those in conjunction with one another for the families that want to become a naturalized citizen and perhaps are not they don't know the language well enough to be able to pass the citizenship interview or the exam. They take ESL classes with us to be better prepared for that. Our food pantry is accompanied by nutrition classes because we recognize that when it comes to health, many of our community members are facing diabetes, high blood pressure. So we want to be able to educate them on how to make healthier choices and be a little bit healthier and start young and then continue as adults. Financial literacy, obviously, that goes with our Family Advocacy Center program, housing assistance. We haven't made it a requirement, but we do highly encourage all of our clients to go through that so they have that background and are sustained. Parenting and family support groups, which is, again, one of the newer services that we provide. That's that.
I just have to say, wow. I mean,
Thank you.
you drive by and you're in an old school
Yes.
and you do all these things. So that's impressive. For your food pantry, do you work with like local gardeners or anything, or are you allowed to do that?
We are allowed, so
Reasons.
those are one of the partnerships that we want to be able to solidify. We do have some partnerships with the local farmers, but it has been pretty inconsistent. So we want to be able to tap into that on a more frequent level.
And you do focus a lot on childcare and their well-being, and that is awesome. I'm a former educator, and it starts young and it
Yes.
carries over. You when I was there, you had a library, is that,
A mini community library, yes.
and that's for resources, or do they check out books?
So it really goes hand in hand with all the adult education classes that we offer. If somebody wants to learn a little bit more about budgeting, we have books in Spanish and English that they can basically just borrow and return or keep at their pleasure, and then just review them. And that goes with everything. And then we have some partnerships that replenishes all those materials.
And I know it's an old building, and if I recall correctly, we're talking about the ADA requirements. How are you doing with?
We've made
Compliance.
some progress. The biggest obstacle has been that the building is 4 stories and we don't have an elevator. Right now, we did secure funding to do an ADA platform lift, which we're working on, and hopefully we will get completed before the end of the year. But so far, we're really only able to access the first 3 levels. And even the 3rd level has been difficult for some of our clients. So we find ourselves having to make accommodations and meeting clients on the first level. If they're not able to go all the way up. That's also one of the reasons why we had to secure a second location in Joliet, because we just couldn't continue expanding up, at least not without being
So
inconvenienced.
how many employees would you say you have on,
We have closer to 60.
and how many volunteers do you get?
Volunteers range at any given time, just for food pantry alone, we have about 15 to 20. Many of them are students. The local schools require them to complete community service hours for graduation. Some of them are referred to us by court. So we allow them to do a lot of that. Of course, there's a process because we have a daycare. So we don't do necessarily a background check, but we do run everybody through the sex offender registry. And then they have to complete an application. We determine if they can volunteer with us or not. But we do offer that opportunity.
Okay, does anybody else have any questions? Hold on, I gotta find you. There you go. County Board Member Williams.
Hi, Sylvia. How you doing? Do you have any programs for formerly incarcerated people? I've been working with a lot of people lately with that, and I just wondered if the Spanish Center offered anything.
Not at the moment,
Okay.
unfortunately.
Anybody else? No questions? Okay. Thank you so much.
Thank you. I
It is
appreciate
really
Yes.
amazing work.
Yeah, and I'll, if you don't mind, I'll go ahead and share my contact information because I know you guys are all out and about in the community. So if there are any needs, feel free to just refer them our way.
Yeah, Sylvia, you have a card. You can
I
give it
do.
to staff, and staff
Okay,
can
sure.
email it to
Okay.
the committee.
Yes.
Did you have a question? I didn't even ask. Nope, you're good. Okay, oh, thank you so much. Okay, next is other new business. And I just checked, a couple of things have come to my, this thing turns off on me, has come to my awareness. And I reached out to Maggie. We have several that are sick or out on meetings today. And so I reached out to Maggie McDowell, and I am trying to find it here. Give me a second. One of them was, COVID has reared its ugly head again at our nursing home. We know that, it just takes one case to put them in a, ugh. This thing. I'm working on it, guys. I'm sorry. Um, I'm on a tablet and it is not always so friendly. It's in red and I don't see it anywhere. But they are in the process. They're back to wearing masks. If you leave your room, you have to wear a mask. They are back to doing testing. There was 22 cases with residents. So they are on top of it. If anyone is concerned, I did have a resident reach out and say, hey, what's going on over there? Maggie is following all of the rules. You know, extra hand washing, wear those masks, keep our seniors safe. The other question, and I don't even want to address it because I can't get anything on my silly thing here. Yeah, it was, good luck. It was in regards to, a grant or a House bill that had come through. There was a question at, some endorsement meeting with AFSCME. And I reached out and she responded. So if I find that, I will give it to you. If not, I will forward Maggie's response and she can send it to you guys. Sorry, couldn't bring it up. We have several informational reports and I did have one added. It was the EMA update from when we had the big storms. They had come and done a presentation at Executive One. It's very informative about all of the things that happened. One of the things that came to light was the fact that there were nursing homes that didn't have generators capable to power, and seniors can't get hot. And they just kept coming, you know, they knew about the first one and then it was like 2 or 3 days later, another one is there. And the nursing homes were taking them to the hospitals, but there wasn't really anything wrong with them and they had to be discharged. So we found that we needed to figure out how to address that. Another problem was a mobile home park had an emergency shelter, but the manager of the emergency home park wouldn't unlock the door. So one of the community members broke through the window so that the people could go to safety. So we need to be, I think land use is going to be working on an ordinance, or the ordinance committee. I know it's going somewhere that's going to be looked at because that should never be a problem. So does anybody have any other questions about the informational reports? There was a lot of information there this week. We do have a public comment. Did you find it?
It's right here. I just can't get it.
Yeah, I will have it sent to you when I get to something that functions. Oh, there is a presentation, even says it. I am so sorry, and I even talked to you before. We do have another presentation. It is the WIC presentation with Sylvia. Thank you, Terry. Okay, I missed one, so just give me a second and we'll get to public comment. Thank you. And if you two don't mind introducing yourselves again, just so they'll have it on record. Yep, I'm getting their mic on. Michael. There we go.
Okay. Good morning. My name is Sylvia Muñiz. I am from the Will County Health Department, and I am the Director for Family Health Services, which is the division in which our WIC program is. And then this is Diana Visvardis, and she is one of our WIC managers. I am a nurse by trade, and she is a nutritionist dietitian by trade. And I brought some information about WIC last year at some point. But this is just kind of like what's new in the program. We had some recent events and we just wanted to share with you. So can we go to the next slide? So we're just going to give you a little overview of WIC. We'll talk about our new milk bank that just opened, had its grand opening on Friday, and also a WIC boutique that we have at our NBO location. WIC is a nutrition supplemental program. We provide nutrition education. I don't want to say vouchers, but EBT cards now for nutritious foods. Clients come to our WIC program and they meet with a nurse, a nutritionist, a dietitian, now a lactation consultant. They may get some referrals for additional programming support. They will get some breastfeeding support. WIC stands for Women, Infant, and Children. It is for pregnant women, breastfeeding, postpartum mamas, infants, and kiddos up to the age of 5. It is a national program, but our families live in Illinois, and they do have to meet an income requirement. We have 3 offices in our main office in Joliet at the health department, an office in Bolingbrook that serves like generally our northern part of the county and even outside of Will County, and then our eastern branch in Monee. What else do you want to add?
Our hours are on there in our phone numbers. Yeah, I'm trying to think. Does anyone have any general questions about WIC that I could answer? Sure.
Sorry,
Yes.
I'm loud, so I didn't think about
Yeah,
that.
me too. It's okay.
What is the income requirement for WIC? I'm curious.
It varies based on the number of people in the household.
Yes.
What's the lowest and what's the highest?
The lowest I would say for a family of 1, I believe it's around $30,000.
Okay.
And then it goes up to like a family of like 20. And I can't remember specifically what that number is because
Got
we
it.
don't use it a lot.
But
Okay.
do you know
If
what
you-
it is based on like the state poverty guidelines, like what the percentage is?
It's 110% of the state poverty guidelines. I
Gotcha.
believe
Okay.
if you go on Will County Health Department's website, on our WIC page, I have the income guidelines listed on there.
I will check it out. I
Yeah.
was always curious about just curious.
No, it's fine. We just redid our website. It just went live actually on Monday. So I updated it with a bunch of that kind of information. So it's a resource for our clients and for people who are looking for that kind of information. So feel free to visit it.
One more.
Okay, go
One
ahead.
more. Oh, and I'm sorry, I'm not trying to monopolize the whole conversation.
You're fine.
So, University of Illinois has the one program that does involve nutrition. Do you guys at all coordinate with them? I'm trying to think of the name of the
The
program.
extension. Are you talking about
Yes.
U of I extension? So
Yeah.
we used to coordinate with them because they would do cooking demos and that sort of thing. Since we moved into our new building, we don't really have a space to do cooking demos. And I know because of COVID, all these restrictions got put into place, but it's definitely something we can look into in the future. I do have a contact over there. I can't remember her name. She's an educator, a U of I extension like educator, and it's been brought up. We also want to work with the Northern Illinois Food Bank. So those two are potential partnerships that we're looking into.
Okay. We could talk about some of the benefits of WIC. So just generally, it reduces food insecurity. We provide some economic stability, definitely improves some dietary intake, supporting healthy growth, improve birth outcomes. We have pregnant women, so if you have a healthy diet during your pregnancy, that improves birth outcomes, health outcomes. Of course, if you are hungry, you can't learn very well. So it supports learning and development. All of this helps to reduce healthcare, other costs, and also the back end of it, or the behind the scenes of referrals that go on through WIC. Everybody thinks you come in and you get, free formula, and that's not what goes on. All of the education that accompanies the benefits of the nutritious foods. And then as we're getting to know the clients, then we'll find out about them and maybe other needs that they might have. So we can refer them to one of our many community or any of our many community partners that we have. So. Our WIC staff consists of licensed registered dietitians, nutritionists. We have some nurses. We brag about our new IBCLC, which is a very difficult certification to achieve, International Board of Certified Lactation Consultants. Very few programs have one. So this just means that this person can provide additional breastfeeding support, more complicated, complex cases. And it's extremely beneficial because we want to be able to, we are very much advocates for breastfeeding, and we want to be able to have this support where a lot of our families think they can't access it for a variety of reasons, or they can't get to the hospital because that's where the only lactation consultant that they might know of is. So this just provides additional support, very valuable to our program and our community. So we're very happy to have her on board. Speaking of, can you go to the next slide? This is her, Alyssa. So this is our great event, great project that we're so very proud of. We have an amazing team in our WIC program, and we have an amazing breastfeeding committee. And this group they got together with this Mother's Milk Bank of Western Great Lakes. And after having discovered that we do not have a place for moms to take their extra breast milk. And there was none in Will County. And the nearest one was somewhere in Naperville and in Olympia Fields. So we partnered with the Mother's Milk Bank of Western Great Lakes. And we are now a milk depot. And what this means is that women can donate their extra breast milk. We are basically just the holder of the breast milk. The milk bank will approve donors. So they do all the testing, they take care of all of that. They provided us with the freezer. And then the moms just come and deliver the milk, and then the milk bank picks it up. We had an amazing event on Friday. Can you go to the next slide? And you can talk a little bit more about that, Diana?
I can. Do you have a question, or is it?
Oh, I absolutely do.
Okay, go ahead. Go.
So we all know that, when a mom takes in certain contaminants, it might affect the milk or whatever. So how do you know that you're getting, decent milk or milk good enough to give to babies?
It's a very, very good question. So we personally at the health department don't have anything to do with the screening process, but the program that we're working with, the milk bank, so they do a blood test initially. They check their blood, make sure all their hormones and everything are okay. They do drug screening. I can't remember specifically what drugs. There's like a whole list that they screen for. And then they also have them fill out so week by week, they have to literally document any kind of medication that they took. So if they took a Tylenol or if they took Midol, like they have to document it so that when the milk is tested, they know like the dates that you took this, and they either might discard that batch so it doesn't get put put out to their clients, or they pasteurize it. It's like a light pasteurization that they do, so it doesn't kill any of the good like hormones and antibodies that are in the breast milk, but the milk bank takes care of all that process.
So since we're stopping for a second, I
Yeah.
just have to say, as a nursing mother, I have to say, sometimes you do have excess and sometimes you run out.
Mhm.
And the biggest need that I found was at hospitals with premature babies,
Mhm.
because breast milk does have the nutrients and the antibiotics and all that good stuff in there to protect baby. They love getting the
Yeah.
stuff. And when
Mhm.
I was having my children, they didn't have this as an option yet. And I'm
Mhm.
very thankful that they have figured it out,
Mhm.
because I've had neighbors who have used the
Donor
donation.
milk.
Yeah.
Mhm.
And I've also had some that have donated.
Mhm.
So, I mean, it's a wonderful service. I'm glad you guys have.
And the milk,
Jumped on.
a lot of this donor milk is going back to exactly where you said, our preemie babies in the NICUs
Mhm.
in the Will County hospitals.
Yep.
So, yeah.
And as far as the lactation, it's so important. Leche League came out and they were very prominent in like the
Mhm.
70s or the
Mhm.
80s, but they've kind of died away and nobody knows where to go,
Yeah.
with a clogged duct or
Mhm.
latching on problems. You need help.
And then they give up, and that's kind of like,
Mhm.
or they feel like she's a terrible mom, and it's like, no, that's not, yeah, that's,
And the village that we used to lean on,
yeah.
Mhm.
It's
it
gone.
it's not the same.
Yeah.
So thank you. Go ahead.
course.
Sorry.
So no, it's okay. I'm sorry so you brought up La Leche League. So at our event that we had on Friday, we started talking about that because we had some other community partners that came from Catholic Charities, and we started talking about maybe bringing La Leche League back to Will County, but that was just like a very brief conversation. But
The thing that they offered was like a support group. And
so
that was always good. Mothers helping mothers.
we always talked about that with our new IBCLC, Alyssa. She's like, I want to do a support group. I'm like, okay, we'll get there. We'll get there. Baby steps. We'll get the milk bank in place and then we'll work from there. But we had this awesome grand opening event. The Mother's Milk Bank was there in representation, and they had a bunch of giveaways and little, I have flyers here for you guys, little flyers that I can pass out. Our event consisted of, at 10:30, we had a latch on where breastfeeding moms came and either pumped or they latched their babies. We had a pretty good turnout. Oh yeah, thank you. I am actually a breastfeeding mom. I have a 8-month-old, so I sat there with my pump, and then actually 3 other of my staff actually are also pumping, so we were all there pumping. And then we had a client come with her, I think he was 1 years old, her 1-year-old, and she was breastfeeding with us. So we just hung out and kind of had a support group there. And then at 12 o'clock, we had Helen from the Milk Bank give an informational presentation. And then at 1, we had our ribbon cutting ceremony. And then people kind of just got to walk around and see the WIC clinic and see the freezer that we have located in one of our offices in WIC. So it was a good event.
And our first donation.
Oh, yes, yes. So Alyssa, one of our staff members, the picture that you saw, she was actually our first official donation. So we gave her a certificate for being our first official donor. But then also during the event, while our executive director, Elizabeth, was talking, I had a mom walk in and she was like, I'm here to donate milk. And I was very caught off guard. And I was like, are you an approved donor? She's like, yeah. And I was like, we literally just opened today. Like, how did you hear about us? She's like, oh, on social media, I found out you guys were a location here. So I came to drop it off. She's like, but I'm on my lunch break. And this was super convenient location. And I'm like 5 minutes away. So she came in, she filled up our freezer. And I was like, oh my God. I was like, this is amazing. So I was very, very appreciative, but completely caught off guard that the word spread that quickly. And we've just been posting on social media, really. If you go on the Mother's Milk Bank website, they have our location on there now with our hours and our phone number. So you can find us that way also.
And the representatives took the milk with them on
Yes,
Friday.
they did. They just took it back to the facility where they process it. So they just took it all with a whole trunk full.
How exciting.
Yeah. Any questions about the event or?
Are there any other questions? Well, it sounds like you guys are doing great stuff. You know, it doesn't look like you're done yet, so.
So this is our WIC boutique. So this is mainly at our Bolingbrook office right now. And this kind of originated from one of our manager's daughter in nursing school. Her program, her project was basically creating a boutique of everybody has all this leftover baby clothes because they, wear it for a week and then they're done. So we had, they basically have donations from the community, staff, Once Upon a Child, and they house clothes where our clients can come in and pick up what they need. This is a video. Can you play it? Oh, no. Bummer. So it's really cute. It has, you can see the display of the clothing that they have there. It's a very small space, probably 8 by 10. No, not even, probably 4 by 10. And they have clothing. We opened it in June. We've given, as of last month, that was about 600 items of clothing. I would guess it's close to 1,000. Over 800 families have visited our little boutique. And we have bins and bins. I think Jen said she has about 14 bins of clothing in her garage that has been donated. And we take the clothes, they take the clothes, the staff launder them, and then just constantly refill them as clients take them. We did partner with Once Upon a Child, and any two things, he will, if he rejects clothes, or if he can't take them because there's too much from the people that try to sell, he recommends that they bring them to WIC. Or at the end of the season, clothing that he has left over, he donates to our WIC boutique.
So what do you do with, you said you had a resale shop. What do you do with the proceeds from that?
No, it's not a resale shop. The resale shop donates their
Okay.
leftovers to
So
us,
it's
basically.
free. That's even great because I know that WIC parents,
Mhm.
they're so financially burdened
Mhm.
that to go even to Goodwill
Yeah.
is expensive. And so the donations are always helpful.
And it's going, I mean, and they've had, they've given excellent feedback, positive feedback. People have come in that were not WIC clients in need. And then I think they become WIC clients.
Mhm.
It is, we have clothes up to 5T because that's our WIC our kids are up to age 5. And we can only take clothes because there's room for nothing else. But it's been a very welcoming, very successful, helpful program for our community there.
So with your education, because I do know that if you receive WIC, you also have to have the education.
Right, the nutrition
classes.
education.
Are they in person now or are they option for virtual? Or is there mandatory so many hours?
It's kind of a
person?
hybrid. Do you want to talk a little bit about
Of course, yeah. So with WIC, technically we have to have contact with our clients every 3 months. So the initial first contact is called a certification appointment, and that's when we require you to be in office because we have to do your height, your weight, and check your iron. The next appointment can be hybrid, either over the phone or we have an online class platform. And then 6 months from the initial certification, that's called a mid-cert, and that is required to be in person again because we have to check their height and weight. So it's every 6 months you have to come in person, and then those appointments in between can be hybrid, either online or over the phone.
Is there any other questions?
I know prior to COVID, we had all those appointments in person. So now we have the option of doing the 2 hybrid ones, and our clients really appreciate that.
I did see the hand raised from But, ma'am, we have to have you on mic, but if you guys would like to touch base, because I do know that does the public get to ask questions? Not really. So if you would reach out to them,
Sure.
grab a hold of them, they have a question for you. And I don't
My
want them to
contact
be
info
missed.
is at the end there, so if you have any other questions,
Wonderful. Thank you so much. I'm excited.
Us too.
And I'm sorry, I skipped over that one. Okay. And now we have public comment. And we do have a public comment. Would you two like? Yes, you do. Thank you.
No, totally fine.
You have to come up to the mic, and if you don't mind giving us your name,
Okay.
and you'll probably have to tell us, where
Yeah,
what area you're speaking of.
okay.
The one with the red light. There you go.
We're Bob and Jean Heniff. We live in the Chartwell Downs subdivision in New Lenox. And this is a small subdivision of 42 residents. And it's built in a wooded area with a lot of water and Hickory Creek running through this subdivision. And we've lived there for probably 28 years. And it's been really nice. And all of a sudden, we have two homes under construction. One, a 13,500 square foot home with 10 bathrooms, has been under construction for 2 years. And the subdivision has a plat and a covenant that are both filed in the Will County court system. And you are required to only build one residence per property and put one cavitat system in. And we have people on both sides of us that have installed seepage fields. So it's very concerning. It's a wooded area and their installs have been inappropriate. One is placed in a floodplain and it's 11 feet from Hickory Creek. So the sewage would flow into the creek, which is against the plat. And the other is installed on a hill with a 12-foot slope pitch, 5 feet from our property. So, yeah, so when this system was designed, I don't know if any of you know about septic systems. Okay, good. They have, this is a trench system that they installed on a hill. And they pointed the pipes of the trenches so that when the system blows or fails, everything will flow onto our property. So, and they also placed sewage tanks 5 feet from our property line in our frontage. And everyone is supposed to honor the 10-foot easement from your property line, and they haven't done that. And this construction has been going on for 2 years. And it doesn't seem that there's oversight, proper permits. Yeah, so it's very concerning that there's no oversight. And we've watched everything else in the subdivision go up, and no one can believe this. They've also changed and altered the lay of the land and elevated their foundation line 6 feet above the lay of our land. So they've built up the whole property. So all of their water, you can't change drainage, that's illegal. And they've cut off our drainage to a sewer by elevating their property. It took 1.5 years of complaining to get a sewer installed to help with the flooding in our frontage. So,
As I mentioned earlier, a lot of your concerns are going to be land use, and that one's
Right.
at 10:30. Now, the sewer and the testing, I'm going to have to ask the health department, is that under your umbrella? So I am going to make sure that you get with the health department back there, and they can maybe run out and do some testing. Mr. Ballard, you had a question? Wait. I've got to turn you on. There you go.
No, if you're in New Atlantic City, you gotta go to the village. But if you're unincorporated, then our land use committee meets in half hour. And that's
Right.
probably. the right-
I did tell them that they needed to come to land use. Mr. Butler, you have a
I
question?
had a public comment when they.
Sure.
If you give me the address, I could look into it for you. You know, some of what you said, I can understand the concerns. Today, they don't just have septic fields anymore. They have cavity systems that are attached to drip fields. So the cavity system produces what they call like a gray water, which isn't 100% clean, but it's pretty clean. So, that might come into play because there's no true septic fields out now. They do cavity, goes into a drip field and that, but they have to adhere to health codes, and the health department's very particular about where you place those. So if they're not doing it in the right spot, they will have to move it.
And we will definitely, here at the end, we're going to get you with the health department, and it should probably take your address as well and get somebody to test the area. Mr. Ballard, you had one more? Are you done? Mr. Ballard, are you good?
Yes, I have a comment.
Okay.
A public safety thing, which is unusual for this committee. When you come in the building here, there's 2 police officers, sometimes 3, right? Well, they have a video camera that they can see, but there's no sound. So I asked them, why isn't there any sound? And they said, probably because it costs too much money. And I said, well, how do you respond to a problem from watching something on a TV, which they're not always watching, but they watch it in between people coming in? And they said, we don't. There's no way. So if something was happening up here, they can't hear it. So until something happens bad, they can't respond because I told them, what's the procedure if something is happening bad? They say they lock the door so nobody can get in, and then they come upstairs. Well, if they don't know anything is going on because they can't hear it, because usually before something happens, there's a lot of noise, someone yelling or screaming or whatever. So I'd like to have you put on your agenda for public safety that they have installed on their computer that they're watching, or WebEx or whatever it is, sound. Because without the sound, by the time they get up here, it's too late, and we can't carry our guns in here anymore. Or we couldn't in the beginning. So who's going to protect us? I'm going to go after some guy with a gun with a pen to stab him? Come on.
I know September is going to be pretty full, but we can maybe look for something in October to do that.
Yeah, as
I'll
long as we
have that-
address it, because it's not safe for us.
Okay, we can do that. Thank you both for coming in and sharing your concerns. I was able, as we move on, and usually I will warn you, we don't allow questions and comments. So when you get to land use, it'll just be you making a comment, but I'm a little different here and we're a little bit more laid back. So no problem. Okay, moving on. Where am I at? Announcements by chair. I found and was able to open up this wonderful thing from Maggie. So she said, based on the outbreak, response is initiated with 1 lab confirmed case of COVID-19. The outbreak is open when there is 1 committed case plus another person symptomatic, or 2 or more confirmed cases of COVID-19. There are 22 residents who have tested positive and 28 staff. The steps that are being taken is.
Excuse me.
The steps that have to be taken is following the CMS IDPH requirements as shared and outlined in QSO-23-13 memo from May of 23. Needless to say, the requirements are very different for nursing homes as opposed to the general public. So currently, the staff is wearing face masks, residents are wearing face masks when out of their rooms. COVID testing is occurring on Tuesdays and Fridays for all residents and staff. Hand washing and infection control practices and cleaning with products from an approved list is ongoing, keeping residents and family aware of updates via their automated care messaging system. And faculty must go for a period of 14 days without any new cases to cease the outbreak protocols. So that is the update on there in case you have had anyone ask you. I did, so I reached out. And the question regarding funding for the CNAs, she is thinking that this is in reference to the Medicaid nursing facility rate reform in Illinois, the rate reform House Bill 246 that was reviewed extensively in August or so of 2022. It was not a grant. This was an opt-in or an opt-out option in terms of participation and multiple actual and potential complexities associated with participation. At the time, there ensued extensive discussions and review involving the then Chief of Staff, Mitch Shaban, a labor attorney and an HR director, and the Sunny Hill accountant, and many others. Sunny Hill elected to opt out because essentially when this was evaluated, the Sunny Hill reimbursement system already met or exceeded the requirements to participate in it. So that is all I have for that. If you do have questions about that, please reach out to Maggie. But that's all I got. So she is aware that we are concerned, and she should be back next month. She had a meeting. So that's all I have. Does anybody else have anything they need to add? Mr. Butler.
I guess, according to that announcement, I'm confused. So I'm just wondering, do masks actually prevent the transmission of COVID? And I was just curious if the COVID had been lying dormant and then it just came back.
Can you answer that from the health department? You have to come up, please. I can probably answer, but I'm gonna let the, push your button, please.
Sorry, what was the question?
I was just wondering if wearing a mask actually stopped the transmission of COVID.
Yes, it minimized and I think. No, don't give me your.
Oh, you're good. These are new and it's a lot, so.
And they follow the CDC recommendations right now, which I'm gonna get them all mixed up. But in the nursing homes and in assisted living facilities like that, they are, it spreads like wildfire.
So I'm just curious because when I asked the question, you kind of said two different things. So am I to understand that they do not stop the transmission of COVID, but it could minimize the area in which the fluids are spread through the air? Is that what you're saying?
Meaning, if you wear a mask, she wears a mask, and she doesn't, and she doesn't, we're going to minimize the transmission amongst the four of you.
So the size of the COVID virus is smaller than the filtering membrane that is in the mask. Is that correct? Like the virus could go through the mask. Are you saying it does not, or it does? I'm just asking because I've heard a lot of different things on this, so I'm just curious, like, is this going to save us? I mean,
from a health department perspective, there's one type of mask, it's your N95, and that is the premium mask that we wear in our healthcare facilities.
do the instructions on that say it's good for 20 minutes?
For an N95, that is not exactly my area. I'm not sure. I think it's longer than 20 minutes, but it has to be properly fitted.
But you would have to
Fit
put
test.
at least 8 to 10 of them on a day is what I understand.
For N95.
never heard
No,
that.
I've never
Yes.
heard that for an N95.
Well, it'd be interesting if you could get the instruction. Oh, 2 hours.
They're good for 2 hours.
4 to 6 times a day? Okay, I just curious, because you hear all these things and, I just wonder if we couldn't like talk more about providing zinc and, these other medications or vitamins that like other countries do to build our immune systems to protect these people. Like, do our elderly people get all these extra vitamins and stuff when these outbreaks take place? I mean,
So our goal is always to protect our senior citizens, our
Mhm.
immunocompromised. When people come into, especially our health facility, our community health center, we treat pregnant women, newborns, we treat seniors, we treat immunocompromised. So when there is an outbreak, when any staff are infected, when our medical director determines there's a risk, then we will go to masking. She follows the CDC guidelines. We also have our epidemiologist who tracks the rates within the community. And so we do follow the CDC guidelines regarding masking.
so I'd be curious to know if anybody's, explored the ability to boost the immune systems through, vitamins and other things. Because I mean, like,
I'm gonna
other
go out on
countries
a
have
limb.
sent that out.
I'm gonna go out on a limb because I know you asked this once before of Maggie, especially with our senior population in the nursing home, they can't mandate that they take a vitamin because that has to be determined by their individual doctor. So, you don't know. And so to be proactive, if you wear a mask and I wear a mask, we are eliminating that
So
lot.
I understand
So,
exactly what you're saying, but you
to keep them
can
safe
mandate
is the
that.
number one priority.
If you can mandate a mask, you can mandate a vitamin. They don't have to take it and they don't have to wear the mask, but they gotta go.
One is going into your body and can actually affect your heart and liver and kidney, and one is something that you just place on your face.
Is that true with the
So-
vaccine too, that you don't have to mandate a vaccine?
I can't answer that one for you, Dan. I remember this conversation from before. Please address me.
Okay,
And
yes, I will.
This is Janet Diaz.
Hi, yes. Okay, the reason that the mask is exterior, a vitamin is interior into the body. And the issue is we don't know if the medication, like the vitamin, is contraindicated with some other medication they're on. Like if I'm going to just use this, vitamin K, you cannot take if you're on a blood thinner because you're literally Xing out the other one. So that would be a contraindicated medication. So that's why they can't mandate that. They can suggest it, but but the doctor's going to have to say, oh, no, that's not safe for person A, but it might be okay for person B. That's the issue.
Thank you.
You're welcome.
And we have, this is also a conversation we can have individually. And Dan, I would encourage you to reach out to Maggie if you have concerns, because she always responds. County Board Williams, your light was on first.
Yeah.
Oh, I have to hit the button. I'm sorry.
Well, also too, we have to remember, these are their homes. So if I'm in my home, nobody's gonna come and tell me to take medicine if I don't want to, even my doctor. So I know it's a county nursing home, so there are restrictions there, but it is their home and they do have the option of not taking medicine if they don't want to.
And I'm going to call this as the last one. You get to turn your own on. So there you go.
I got it. All right.
Vice Chair.
So you are right. 100% right, Janet. Certain vitamins do affect your medication. Certain things like, grapefruit juice and blood pressure medication, that kind of thing. However, I'm going to say this, which nobody really talks about. Wear the mask, wear the mask. There are people who have COPD, heart conditions. It makes it very difficult to breathe. Masks can be kind of restrictive. Some people also, yes, I know this for a fact because I have a patient that I live with that has issues breathing with the mask on. Another thing too is that there are people who become, how can I say, psychologically triggered with the mask. They feel it's just like claustrophobic with the mask on. So I'm not saying that people should or shouldn't wear a mask. I'm not making an argument for that. I'm just saying that you can have arguments against the vitamins and you can have arguments against the masks. And we should try a little bit harder to make exceptions for those who who do not want to wear the mask or who cannot for whatever reason wear the mask. Yes, it is very difficult for people with heart failure to wear a mask. COPD, again, that's another one, and any kind of respiratory issues and psychological issues. So that's all I'm saying.
And you are correct, Raquel. My mother has one lung. And when she was going through her chemotherapy, they had to have masks. And one of the things, because she couldn't breathe, because she has one lung, they gave her it was like a plastic thing that went over her face and it allows you to breathe, but there are options that can help with that. And it's
Another
clear,
option-
which also helps with it.
It's like not wearing them.
Right. So, okay,
And survive.
moving on, we have no need for executive. And can I get a motion to adjourn?
So moved.
Can I get a second? Our next meeting is scheduled for September 10th. We do have our side-by-side burn that day. Be sure to invite anyone you know. It will be out, I think we start, how will we start inside and go outside? How will that happen? We will send you directions as we come up with them. It's a little field trip and it's going to be exciting, and very educational. So thank you for coming.